Thank you everybody for your patience. We are now live on YouTube, so anyone that is not able to join via Zoom can now watch the live stream there. So without further ado, Sri Raju Chamarti garu, if you want to take it away and give us the introduction to the program, we would much appreciate that. Thank you.
Thank you very much, Ankita. Thank you, and good evening to everyone, and thanks for joining today. We have a great panel today of doctors, Dr. Meena Murthy garu, Dr. Naveen Mehrotra garu, and Dr. Anna Kuriakos garu, all of them from East Coast, New Jersey. And I want to welcome all three of you to the panel and the Silkanandra family, madams and sir. We are glad to have you here. So before we get started, I just wanted to share a couple of points about Silkanandra. It's a non-profit organization, a 501c3 rated platinum by GuideStar. Have been working since 2001. We have created 9 Guinness World Records. Amazing work we have done in the areas of cultural, academic, and our Indian traditions and service-oriented projects. ManaBadi is one of the initiatives of Silkanandra where so far, we have taught about 60,000 students our mother tongue Telugu across America and in 12 countries. This academic year, we have 11,000 some students and completely volunteer-driven program. This is the only Telugu program accredited in America, and about 32 some school districts have recognized this for world language credit. So amazing work. I feel so proud to be representing an amazing team of volunteers. And I want to take this opportunity to thank them who have been working for years together to drive this mission. And handing it back to Ankita, who is also one of our graduates. And Ankita's dad, Sri Sarath Vetagaru, is one of our vice presidents, has been doing amazing work. And, so thank you, Sarath Garu, for organizing this panel and, this session with our ManaBadi parents and our ManaBadi families. I know it will be a lot of help in these times of uncertainty caused by, this COVID-19 unprecedented times. And so thank you. I welcome you all once again. So let us make it very interactive. Anybody who has any questions, please put them in the chat and Ankita will be moderating them. Ankita, thank you. Handing it over back to you.
Thank you so much for that introduction, Sri Raju Chamarti garu. As Dean and President of Silkanandra ManaBadi, it is very heartwarming to see how much you care about your students' well-being and not just their education, but their well-being in their physical, emotional, and mental health. So thank you for making this connection possible and for helping all of us reach the community in a better way. So like Raju Chamarti garu mentioned, my name is Ankita Veta. And I am very fortunate to be able to be a part of this event today where we have 3 experts in health and education who have readily dedicated their time to answer your questions. So before we go into the introductions, I just want to take a minute to thank all of you for attending this program and investing time in learning about your health and the information you need to take care of your children's health. So like Raju garu mentioned, this will be an interactive opportunity. So in order to assess who we have out in the audience today, I'd just like to ask all of you to quickly raise your hands if you're present on the Zoom call so we can get a quick measure of how many parents we have versus how many children we might have in the audience. This will allow us to better tailor our questions and our conversation. So if you are a parent who is attending, and if you could please raise your hand now on Zoom. Okay, thank you. It looks like most of our audience right now is parents, so we will be sure to keep that in mind going forward as we answer your questions. Now, if you type a question in the chat, I will be able to view this question and make sure to ask as many of those questions to our panelists today. Please do feel free to insert anything that you have into the chat and we'll make every effort to get there. So without further ado, let's start the panel. So for our Caring for Your Children program today, we are fortunate to have the support of 3 experts from St. Peter's University Hospital and Sri Krishna Nidhi Foundation. So to give you a little background, St. Peter's University Hospital is located in New Brunswick, New Jersey, and it serves a wide range of surrounding communities. St. Peter's has consistently provided support to the South Asian community, particularly with their expert care of mothers and children. The senior leaders of St. Peter's have always put in remarkable efforts to expand their connections with the South Asian community, and they're doing no less in this current COVID-19 crisis. One such example of their commitment to the South Asian community is through St. Peter's University Hospital's years-long collaboration with the Sri Krishna Nidhi or SKN Foundation. We're fortunate today to have Dr. Naveen Mehrotra with us, who is the founder of SKN Foundation, which is a community-based nonprofit organization based in New Jersey with a mission to support wellness in the community through education. In recent years, the establishment of SKN South Asian Institute within St. Peter's has allowed for an even larger portion of the South Asian community to access healthcare and community-based resources. So this collaboration has really allowed the South Asian community to access better health and better information. So we're very, very lucky that these 3 people who have such strong ties to these organizations are here with us today. So our main panelists today are Dr. Naveen Mehrotra and Dr. Anna Kuriakos. Dr. Naveen Mehrotra is a board-certified pediatrician, as well as the owner and CEO of My Whole Child Pediatrics, with multiple centers in New Jersey and a special needs center in Delhi, India. With his public health expertise in global and population health, he has helped found the My Whole Child Trust in India and the Sri Krishna Nidhi or SKN Foundation, as I've previously mentioned. Dr. Anna Kuriakos is a medical doctor and currently serves as the program director for SKN South Asian Diabetes Center at St. Peter's University Hospital. She's also the program director for SKN SCOPE program for the care of children with special needs and their families. She also holds a master's in education and has worked as a classroom teacher in rural Mississippi and Newark urban public schools. Her activities emphasize programs for better mental and physical health of children, parents, and our community. And last but definitely not the least, we're very lucky to also be joined today by Dr. Meena Murthy. Dr. Murthy is the chief of the Division of Endocrinology, Nutrition, and Metabolism at St. Peter's University Hospital in New Jersey, and the director of the St. Peter's Thyroid and Diabetes Center. She is also the director of the South Asian Institute at St. Peter's University Hospital. With her immense medical expertise, she is able to provide additional insights for us here today in our Caring for Your Children webinar. So thank you, all 3 of you, for giving your time and being here for our community. We really, really appreciate it, and we look forward to hearing from you throughout this time. So before we start to take audience questions, we were hoping to start with just a little bit of background into the adjustments that people have had to make throughout this confusing and overwhelming time of the COVID-19 crisis. So I'd just like to start off by hearing your thoughts on, with the current social distancing guidelines that are in place, we've all had to adjust to a new way of life. So in your view, what are the most significant adjustments that children might be facing? Dr. Mehrotra, if we could start with you, and then Dr. Kuriakos, you could please add your inputs as well.
Thank you very much, Ankita, for having me on this, and thank you so much, ManaBadi, for organizing this. So it's not just, as Ankita said, about language, but it's about the total well-being of the child. And I think kids often get maybe a little bit out of the limelight because, as we know, the disease has been affecting mainly adults and seniors and people with chronic diseases. There have been some cases in kids, but really nothing that has been attributable as a devastating illness. And the kids have been sort of the silent observers in this. And with all of these changes that have happened, The kids are observing, they're trying to adjust to a new lifestyle. And the time when, which is the most important for their development at many different angles, it's being deprived of them. And I think we as parents need to be cognizant of that fact. We as a community need to know how to address that. And I'm really glad that we're bringing this up today in this webinar.
Thank you so much, Ankita, for introducing us, and thank you for all of the organizers and leaders of ManaBadi for having us. We really appreciate the opportunity and appreciate your the effort that you're taking in connecting parents to organizers and leaders in the communities. So for any child, we know that routine and structure are very, very important. So like Dr. Marotra said, this kind of upends their lives in ways that are some predictable and some unpredictable. So, you know, when kids are normally going to school, there's a lot of structures that break up the day, and such as class periods, lunch times, after school. And now we spend our time really differently. We spend our time, our school time differently, our family time differently, and we spend our relationship time very differently. So those structures and routines have been upset, and we also don't have a lot of predictability about when they'll return. So that level of uncertainty is a huge adjustment for kids of any age, starting from the youngest ones who have any sense of, you know, the change in their lives, to teenagers, young adults, college students, and beyond. And on top of that, everybody has this actual medical threat looming over us as well, because there is a very real virus that we're responding to, which is making our days look so different.
Sure. Thank you so much for starting us off with those initial thoughts. Dr. Murthy, if at any time you'd like to add additional insights, please feel free to. We would appreciate anything you'd like to add. So with that, you know, both of you have mentioned the kind of physical and physiological threat that COVID-19 could present, but also you alluded to some of the emotional and mental repercussions this could have on children and their families. So during these high stress times, what are some ways parents can help children manage their anxieties and emotions?
So the first step is identifying that there is anxiety and that there is stress. A lot of kids may not verbalize that. You as a parent need to be able to recognize that. So a kid may manifest it just by being extremely irritable, not wanting to eat properly, not sleeping properly. They could have what we call psychosomatization, meaning that their stress levels, their anxiety levels can manifest as physical ailments. So a child can have stomach pain, they may have abnormal bowel patterns, they'll wake up crying. So many different things, but as a parent, we first need to recognize that there is in fact stress, and we know that there is going to be stress, right? As we've already talked about, that this whole change in the system, this whole change in their daily routine is going to add undue stress. So the first thing is to recognize it, and then we'll probably get into how to manage those stress levels with the kids in subsequent questions.
I echo everything that Dr. Marotra said, that the first step is understanding, you know, that those anxieties exist, and to even understand where they come from. So, I mean, even for the adults, this is a new situation. It's an uncertain situation. It's an uncontrollable situation. And kids are feeling that too, and they may not express that in the same ways that adults do. But there is also, in addition to this loss of structure and routine, there's also a sense of loss for kids, because this, with respect to the experience that they would normally have at this time of year, and that could mean, it could mean graduations, it could mean proms, it could mean end of year parties, it could even just mean being outside in the springtime as the weather gets nicer. They're losing some of those opportunities, and they're not really sure when they're going to come back. And so that adds to a level of anxiety as well. And then, of course, lastly, they may know people who've been affected, or they may have friends who know people who've been affected, and that adds to a level of anxiety as well.
Sure. So it sounds like, there's obviously a lot of different factors that could be manifesting themselves as stress and anxiety in children. And one of the difficult things might be figuring out how much of that stress is quote unquote warranted. Dr. Mehrotra, can you speak a little bit to how big of a risk is COVID-19 actually to children? I know you alluded to this earlier, but we have an audience question here, asking to see if you could speak a little bit to the statistics of how COVID-19 might affect children of different age groups in the United States.
So there's the only research that we have, the large research we have is from China. And that was a study that had over 2,000 pediatric cases that they had studied. And in that, we had about 4% were what we call asymptomatic, is the kids who just didn't know that they had anything. About 51% of them were mild. So they had maybe a little bit of fever, a little bit of myalgia, cough. About 39% were moderate. So they had other symptoms like pneumonia, which were treated maybe outpatient. And then about 5% were really severe, which required a little bit more in terms of oxygen or hospitalization. There have been no reported deaths that are directly attributable to corona in kids. There have been deaths where kids have been found to be positive for corona, but they have not been able to link the corona as the main cause of death for kids. So we can say that yes, they're a pretty safe population, but the role of kids that becomes key for us as a community as a whole is that they become what we call asymptomatic carriers. And they then transmit that disease to their grandparents, to their aunts and uncles, to other people. And that, when it transmits out to the seniors or the other people that are much more at risk, it can be devastating for them. So even though the kids are not directly being affected, they are an extremely important part of the whole cycle on how the virus gets transmitted. So we need to, as a community in the whole, we need to make sure we keep on reminding the kids of the importance of why we're doing social distancing, why we are asking them to have the hygiene and the hand washing and all of those daily routines that we're going into, and why they're being kept at home is because that we don't want this virus to be transmitted out to other people because the kids are asymptomatic carriers.
Thank you, Dr. Mehrotra, for giving us a better perspective on the extent of the risk to children. I do want to circle back to the topic of how we're actually addressing the stress in children, whether directly related to the fears they might have about COVID-19 or just because of the stress they're experiencing as a result of the situation right now with social distancing. What tips do you have specifically for parents in helping manage their children's stress?
So just, I think even before we get to the management, the stress is coming in from the constant news that we're hearing, the constant discussions that are happening. Yes, the kids are at home, but are we watching the news 24/7? Are we constantly, even at the dinner table, talking about, oh my God, this happened or that happened, or oh my God, this is what the governor said or the president said? If we have to remember that we as parents are role models for our kids. So whatever feelings we exude, those get absorbed by the kids, and those kids then internalize those feelings, and which then leads to the stress. So we have to make sure, how are we presenting ourselves to the kids, and how can we alleviate their stress? So we as parents, as a family, have to de-stress ourselves, and automatically that'll be a big step for the kids to decrease their stress. And then also other things that we would do on a day-to-day basis, which we'll get into. Anna, you may want to add a little bit more about this as well.
Sure. So one of the tricky things about emotional psychological stress is the guidelines aren't as clear as for what to do for your physical well-being, right? I'm sure if there are kids on, I could ask any number of them, how far apart should people stand? How many seconds should we hand wash for? Those guidelines are very clear and very strict. It's a little bit more difficult because there's not really a one size fits all approach to how do we manage psychological stress and how do we deal with things that trigger us in particular. So a couple of the things that are applicable to all parents are, keep a close eye on things that are within your power to control. So things like sleep hygiene, things like physical activity, things like diet, make sure those things are controlled and regulated and as much as possible on a routine. I would really, really encourage all parents to talk really honestly and regularly with their kids about how they're feeling. It's so easy to say, but especially in a time like this where you might have more time together as families, this may be an appropriate time to connect more than usual or in different ways than usual. And I would add to be very, very honest and, don't say, when this will be over. Don't say, when school will start again. Don't make promises for the summer, be clear about what we know and what we don't know, and obviously give age appropriate information, and listen to what they're upset about, even if you don't have a solution. That act of listening earnestly and caring about how they're feeling does go a long way, just so that they know there's a safe place to express that. And finally, I would echo what Dr. Mehrotra said about modeling really good behavior in terms of your, sleep, exercise, diet, but also your self-care, your calm, even help seeking, when you're stressed, do you ask people to help you? When you need somebody to talk to, do you reach out and find a friend? How do you show kids how to stay optimistic? How do you show them how to stay future focused and not to get really, really down about what's happening now? So model all those things and kids will follow.
Right. And most importantly, I think as parents, we have to remain calm. We have to be reassuring that kids are safe. The biggest worry for a kid is that, are they safe or not? What's going to happen next? That uncertainty that we keep on talking about, nobody knows. But we as parents have to make sure that we tell our kids that they are protected, that we as parents are there for them. And whatever it is that's happening around us, we will get through it together. And that's what I think the kids are looking for. And that's what we have to go ahead and make sure and try to be as normal as we possibly can. I know there are lots and lots of families out there that have been affected very negatively and have been devastated. And it becomes extremely difficult to try to be as normal as possible. But wherever we can, wherever our situation allows, we have to make sure that we're not hiding the information from the kids. We're letting them understand that there is a light at the end of the tunnel and things will normalize. And this time where everybody's at home is great for everybody to be together and spend together, but it's not vacation, right? So it's not a time where the whole system is upside down, inside out, and they can sleep when they want, they can go ahead and do their work when they want, they can eat no, you still have to maintain those routines.
Thank you so much, Dr. Mehrotra and Dr. Kyriakos. The common themes throughout what you've said seem to be focused on positivity, but also honesty. And I'm sure the parents have really appreciated hearing that from you, in that, sure, there's uncertain times, but we will get through it. And that's a very affirming message to hear when there is so much anxiety surrounding this topic. And part of what you both alluded to in kind of creating that positive environment for children at home is to continue to maintain structure. Now, we've gotten a parent question about screen time. Specifically, a lot of the students and children now have to rely on technology to access their education materials, but also probably for social reasons and staying connected with their peers. How can parents help regulate children's screen time when so much of their lives require this online presence?
So this is a tough question in the sense, what is right, what is wrong? Nobody really knows. I know the American Academy has gone from, trying to limit screen time to almost none, to maybe a couple of hours a day, to now whatever is required to maintain sanity for everybody and make sure that you're not media dependent. So if we look at the overall day for a child, you have to make sure you maintain their schedule as if they're going to school. They go ahead and partake in all of their school activities, their classes online. That is something that they need to go ahead and do. After school, when the school is done, if they have any after school activities that are online, you have to go ahead and offer that time frame for them. They will be online. And then, once all of those obligations are done, is the time for the kids to socialize. And yes, we don't want them to be totally on their screen, for the rest of the evening and not socialize with, you as parents being at home. They do need that time to socialize with their peers. And especially if you're adolescent age group, that is what is really missing for a lot of them when they were out at school, or even our younger kids who interacted with their peers in person at school. They're missing that. So you have to give them at least something that will allow them to be as normal as possible. So they will be on screen. They will go ahead and text. They will go ahead and watch, maybe have watch parties and so on. What you as a parent have to do is to see and be in the background and observe what are they actually doing? Who are they conversing with? Who are they interacting with? As long as that is safe, then your child is okay. And once again, have a timeout for family time. Have a timeout for kids to play with you. Have a timeout for the family meal times, and then let them socialize with their peers. We have to be strict with limit setting, but we cannot be as strict as we used to be when life was maybe a few months ago. Anna, you want to add? Yeah.
Yeah, I totally agree. I would just add that, the virtual learning is so very different from classroom learning. And so it may seem like kids just have, a ton more time online. It may seem they just have 4 more hours to be online, from what they were used to before. But really the process of learning through a video, whether it's synchronous, which means the whole class is together, or if it's asynchronous, like the teacher assigns something and the kids are doing it at different times, that looks very, very different from the time they're spending on social media or on, Instagram or something like that. So, and we can talk more about virtual learning if that's something parents are interested in. But don't be surprised if, kids get fatigued with online learning a lot more quickly than with something like social media. They're structured very differently. Their attention spans are very different in both. And they function very, very differently, and their brains are working in different ways. And lastly, I would just say social media is a little bit of a misnomer in that it's not a substitute for human interaction, right? There is a social aspect to it, and that there's a digital community in which you're interacting. But as much as possible, I would encourage parents to have kids talk to their peers on the phone, FaceTime, do watch parties like Dr. Maratha mentioned, but real-time conversations, less just scrolling through Instagram, posting on Facebook, finding out, just looking through feeds essentially. That's what I would add to that.
And I think the thing is, we know that this is a temporary phase. So all of the research shows that if a child is addicted to the media, to social media, or is on screen for months and months and months, it impacts their development. It impacts their learning of human interaction. There's a higher incidence of depression and other mental disorders that are associated with it. But if it's a short time frame, which is a few months long, hopefully we'll be out of this phase soon. The research shows that these kids will be back to normal, will bounce back very quickly.
Thank you both for your inputs. There were a lot of great tips there. Dr. Kuriakos, you mentioned how the ability to concentrate and process information might be different between online learning versus what students are typically used to in the classroom. Could you elaborate a little bit more on that? And especially if you could add tips on how concentration might be able to be retained in this new environment.
Sure. I think for parents, the key thing to understand is that virtual learning is not just classroom learning on a screen. It looks very, very different. I'll give you some examples. In a school, you have a huge number of cues for transitioning from one thing to another. You have bells, you have different classrooms, you have different teachers, there's after school activities. So there's a lot of things that tell you what you're gonna do when. Those may happen in the virtual learning environment as well, but what you don't have is you don't have the human interaction. So you don't have the processing partners that you normally would have. You don't have other students to talk to and engage in conversation in the same ways. Some digital platforms will allow for that kind of interaction, some don't. So you don't have a lot of the, even in a classroom that uses devices, sitting in front of a computer for a few hours doesn't have the same, there's not the same quality there as there would be in a classroom. So some of the things, if you understand that, then it makes sense to know that kids may react very differently. They may react, their interactions in a virtual learning environment may be very different from their normal behavior in an environment. They may not be taking notes the same way. Their eyes have to be kind of in a, on a laptop screen for hours at a time, which you're never doing in a classroom. You're never looking in the same place for hours at a time. You have lots of stimuli that you're attending to. So one thing I would say is for the parents to really understand what their individual child's virtual learning classroom looks like, what that distance learning or remote learning, whatever the terminology they're using is, looks like. Is it the student is in front of a screen and the teacher is talking to them live? Is it that there are assignments posted and they have to do them on their own time and submit them? Having an understanding will help to attend to some of the needs that kids will have. And then don't be shocked that it looks different. Don't be shocked that a student who was very, very on task all the time and was able to stay focused in a classroom needs to take a lot of breaks, needs to walk around, gets very fatigued. Those are things that are normal when you're in a very, very different environment than usual. So I would say, being asked for, and then also try and figure out what the best way to maintain some of those kids' routines are.
So one thing I would always recommend is, make sure that just because you're at home doesn't mean that you're not going to shower in the morning like you would have when you go to school. So keep that routine. Get the kids ready on time. Make sure if they're, if there's classes starting at 9 o'clock, that they're ready and they're going to class. So they have their space where they're going to be sitting down and going to, learning. They've had their breakfast. They then go from period to period, from one class to the next. They can take their break. They can take their bathroom break. They can take their lunch break. So that whole structured day has to be replicated at home. And the kids have to follow that and have to maintain that. And then at the end of the day, the parents can ask the kid, hey, how was your day? When the kid comes home from, on a school bus or wherever they're coming home from, the parents will go ahead and ask the kid, don't forget to do that. Don't forget to, go through that whole routine that they normally would have. So you can normalize life for them as much as you possibly can.
One more thing I would add to this discussion about routinizing the day for a kid who's studying from home now is, especially if parents have concerns about schoolwork, reach out to the teacher. A lot of times, we know that this is one situation in which the teacher actually does kind of understand what the situation is. Everybody's going through the same thing. So if you're struggling to figure out how to get a student to be a little bit more engaged, or which assignments they should focus on, or how to structure their day and what to prioritize, it's a really good idea to reach out to the teachers who are doing the assigning anyway. And it's a good idea to figure out, this will look different for different school districts across the country and across, districts, but what will they prioritize? What does grading look like? What things are going to affect what their academics look like for the rest of the year?
And this will really play into any of our special needs kids, any kid with a chronic disease that they may require to take frequent breaks throughout the period. And that's where you would need to talk to the teacher.
Thank you both for those excellent tips. I'm sure that hearing some of these tangible strategies will be really helpful for parents when everything seems very cloudy and unsure. So with everything we're doing now in terms of social distancing and just the lockdowns that are going on, we are hoping eventually to work back towards normal. And part of that involves the reopening of schools and businesses. So there's been a couple of questions from families about the nature of state governments making the decision to reopen schools and public places, and the safety or the lack thereof of that decision. So Dr. Mehrotra, can you please speak to whether or not this should be a concern for parents and just the general safety of those decisions?
Right. So I don't think anyone has the answer to that. We will have to see as the country reopens on a phase-to-phase approach. We'll have to see how the cases come back in again, and we'll have to take it from there. So I don't think anybody knows the answer to it. We will roll it out as slowly as possible. I'm sure, you know, we have so many experts working on this, and we'll take it. All we have is what has happened in China and other countries where it has, you know, the country has been reopened.
Sure, thank you. And for those of you who've been present, Dr. Mehrotra also previously spoke about the specific risks to children right now, and you can always feel free to revisit that information. So we're getting a few more audience questions now that I would like us to try and answer, if that's okay. So we've touched a lot on maintaining routines and kind of making sure that children can have as much of their mental and emotional well-being in a good place as possible. But some of what comes into play, especially with younger children, might be physical activity and how the situation now might be limiting that. So Dr. Mehrotra, could you touch on how parents can work in physical activity, especially for younger children, you know, any exercises or warm-ups that you might have to help keep their energy levels in check?
So as I said, the main thing is to keep that keep the routine going. And if your child was had some sort of a physical activity that was part of their daily routine, which should be for all kids, this is the time when you can use media. This is the time when you can look for online, you know, physical activity classes. This is the time when you can use their game consoles, their Xboxes or PlayStations, whatever is currently at home, where they can have those games which can give you, which can be an interactive physical activity play. If you and your kid can have physical activity sort of game offs, you can work together, you can exercise together, you can run around the house, whatever, you know, do things where it'll get you up and about and running around. And I'm sure all of us need physical activity, especially since we're constantly sitting on the computers all day long.
Certainly, yeah. I think, like you said, making that a part of the family experience is a great opportunity. And I guess building off of that, some families are looking to continue to take their children outside as much as possible. And there has been general guidelines regarding wearing masks. So if specifically for younger children, if they have toddlers, is it still safe to be going outside as long as they're wearing masks and maintaining social distancing precautions? Dr. Mehrotra.
Right. So the recommendations are that when you're outside, you should be covered with a mask. You should keep your social distance of at least 6 feet. So if in your neighborhood allows, you can step out of the house, take a walk around the block. You can walk around the house. Unfortunately, for control purposes, all the parks are closed, so you don't have any trails that you can formally go into. But definitely, you can take your kids out, make sure that if they're out, they're covered, and they keep their distance from anybody else that's out there for at least 6 feet. And a little bit of sunshine is going to be good for their vitamin D absorption anyway, so that's good.
Sure, thank you. So while I screen some more audience questions that we are getting in, Dr. Kuriakos, do you have anything to add in terms of any exercises or practices that children can use to keep their activity levels up, and especially if you have any tips for how to quote unquote boost their immunity at this time?
Dr. Mehrotra can probably answer that piece better than I can, but I can speak a little bit to what I think are some good ideas for families to do together, including physical activity. I think actually this is a really special time in a lot more ways than one, and we're finding that it's a challenging and difficult time, but it's also a very unique time. A lot of times families don't get this kind of this amount of time together. So it's a really, I think, cool time or season to come up with some family traditions, play a board game, have a movie night, go on a family walk, create a scrapbook. There's a number of projects that very inventive families have done and have posted online and can show you how to do. I'm sure if kids are talking to their friends or parents are talking to their friends, you can get a couple of ideas to make some new traditions at this time, because it is very different. And like Dr. Mehrotra said, we're probably going to normalize back to something that's a bit more familiar to us, even if it may not look exactly the same. So it's nice to be able to take advantage of this. And along with that, I think it's important for everybody to recognize, and I've talked to a number of educators, a number of classroom teachers, and a number of parents of children, neurotypical children, as well as children with special needs. And I think everybody feels this sense of like, yes, academics and the schoolwork part is really, really important. But it's also okay that we're prioritizing a little bit differently in a time where anxiety levels are high, stress levels are high, and routines are very, very different than normal. So as far as, activities during the day, I would really encourage people to look into what new things what creative things can you do, what expressive things can you do together, and not worry so much about how much is my child doing for school, how much is am I able to support them with that, and take advantage of the time you have together. But I'll hand this back to Dr. Mehrotra to speak about boosting immunity in kids.
Right. So this is a common question, especially for, I think, a lot of our community members. There's tons of different potions, I guess, if you can call them, or different supplements that people say, here, take this and your kid's immunity will be fine, will be boosted up, and that it will go ahead and protect them from any sort of illness, including the coronavirus. Unfortunately, there is nothing that can be given as a supplement. There's nothing that research shows can go ahead and boost their immunity. What we do know that boosts immunity are things that are like, when there's babies should be breastfed. And if they've been breastfed, that's great. That's one added feather in the cap. Secondly, make sure that they have the good hygiene and hand washing. Every time they're going to the bathroom, they go ahead and wash their hands. Every time they are going eating, prior to eating, that they go ahead and wash their hands. Make sure that they've maintained their immunization schedules, that they have kept it as much as they possibly can close to the recommendations. Make sure that they're eating a nutritious meal. They're worried about all of the different food the different food groups, the fruits and vegetables, the proteins, the dairies, and making sure you have that balanced meal. And finally, a good sleep. Make sure your kids are getting the proper sleep. So if they're in the preschool age range, they should be getting anywhere between 10 and 13 hours. If they're in a toddler age group or a little bit school age child, 9 to 11 hours. If they're adolescents, 8 to 10 hours. So making sure that they're maintaining their sleep cycle, making sure that they're eating well, making sure that they have good hygiene. These are the things that are going to boost their immunity. There's lots of rumors out there that, extra vitamin C, extra vitamin D, extra zinc, extra supplements of this sort or that sort are going to go ahead and boost their immunity. There's no research or science that supports that. The most important thing, as I said, is to be positive and have a good lifestyle.
Thank you, Dr. Kyriakos and Dr. Mehrotra. We seem to be getting a lot of questions related to immunity specifically. And one concern seems to be, let's say a child has been exposed to the coronavirus in the environment. Will that automatically give them protection if they were to be exposed at another instance, and will that protect them from actually contracting COVID-19 in the future?
So just being exposed will not develop your immunity. And it doesn't mean that if they're exposed again, that they may not contract it. So exposure does not equal manifestation of disease. And Dr. Murthy can probably speak a lot more detail about that because she is directly taking care of adults with COVID at the hospital. But for kids, this is not something that is going to manifest an immune response just by being exposed. Just to add back to our prior point about immunity and food, I know there were some questions that had come up about how do you handle regular food? Like, how do you take care of fruits and vegetables? What do you do? Do you wash them with, cider? Do you wash them with vinegar before you bring them in? Do you cook them in? How do you bring groceries from inside the house? How do you bring those packaged stuff from the grocery store in? What do you do with it? Once again, we don't really have the right answer to it. Make sure you go ahead and wash your fruits and vegetables like you would any other time. There's no other special added materials that you need to wash it with. There's no thing about, spraying it down with Lysol and then washing your vegetables and then cooking them and eating them. These are all hearsay and these are all theories that people have, but as far as I know, there's no research that supports the validity of doing all of that. And if anybody else on the panel has any more, research behind it, please do let me know because I'm not aware of it. So.
Sure. Thank you for clarifying that. I think there has been a lot of information going around, not all of it, which might be reliable. So another concern that a lot of families might have during this time is, especially if they are essential workers and they still have to go into work, how can they best help protect their family members from this unnecessary exposure to the outside environment? What are the tangible steps that parents can take to protect their families when they come home from a necessary trip?
So I think you cut off Akita, but I think I got the question was that if you go outside as an essential worker, when you come back in, what are the steps that you need to do to protect your family?
Angita, you got cut off at the end, almost at the end of the sentence.
I apologize for that. Are you able to hear me now?
Yeah.
Yeah.
So I think the question was, how do you, if you're an essential worker, how do you take care of your family, right? When you, right.
Precise, yeah.
Okay. So
What are the tangible?
right. So coming home, making sure that you, you know, change, you go ahead and take a shower, wash yourself as much as you possibly can before you handle anybody else at home. Really, I think that is the most important step. If you have any sort of symptoms of fever and cough, make sure you quarantine yourself and be in touch with your healthcare provider to figure out what the next steps are. But most importantly, if you're out, come back in, take a shower, change your clothes before you go ahead and interact with other people at home.
Thank you, Dr. Mehrotra. Could you please clarify the difference between someone being symptomatic and asymptomatic, especially with regards to how asymptomatic carriers are able to spread the disease?
So an asymptomatic carrier is somebody who has the virus in their nasopharynx or on their skin. They've transmitted the virus, they have it on their skin or in their body, and then they go ahead and touch somebody else or through a droplet, cough or sneeze on somebody else, and they go ahead and transmit that virus to somebody else. So being an asymptomatic carrier, you can pass that on to somebody else who can then manifest the disease. Now, if you're a carrier, you can still have the disease if it internalizes, if you internalize the virus, and it can, at that point, even cause different grades of the disease. And nobody knows what grade of disease that you'll have. If you have mild, moderate, or severe.
I don't know if the question was also referencing just the difference between what asymptomatic and symptomatic means. And that's just that somebody's showing symptoms like cough, fever, difficulty breathing, things like that, versus asymptomatic is somebody who's not feeling sick, but is still a carrier of the virus.
And Ankita, Raju Garu actually raised his hand. I don't know whether it is a question or something. Raju Garu, please go ahead, and if you want
No,
to
sir, that was, I'm going to lower the hand down. So the question was already answered.
Okay, thank you.
Thank you. So as we move forward, I just want to remind everyone that we probably will take maybe 3 or 4 more questions before we start to wrap up. So if you have any lingering questions, please put them in the chat now, and I will try to find a way to consolidate them and make sure that we try and address your concerns before we leave for the night. Dr. Mehrotra, I apologize for continuing to pepper you with questions, but it seems our parents really want to know some of the science behind the disease and how it might pose a risk to their families at this point. So along the lines of information floating around, there is this talk of hydroxychloroquine being given to people potentially as prevention. So is that a valid strategy, and should parents be pursuing that option for themselves and or their children?
Okay, for kids, no. For adults, I'm going to defer it to Dr. Murthy to answer, but as far as I know, for adults also, the answer is no. But Dr. Murthy, please add in if you.
Okay, I'm going to take a few minutes. First of all, not just to answer that question, just to thank ManaBadi parents, senior leaders for organizing this, and to reflect on the wonderful tips Dr. Mehrotra you gave and Dr. Kyriakis you gave. As a physician who has been treating adults, but have been involved with families, and having been brought up by an Andhra mother, and as a grandmother and a mother, and concerned about kids and my own patients, I can just say this is something very, very helpful. What I am, seeing is the parental stress, and how then that transmits to children's stress. So children are mirror images of us. Our anxieties in our eyes transmit directly to them, and they, imitate our behaviors. They imitate our coping skills, and they imitate our concerns or our, solutions. So it's, and what I'm seeing is tremendous anxiety about physical well-being, where physically one is not even sick yet. We haven't acquired the COVID yet. We have a concern that we may get exposed to it, but it's already transmitting as serious mental health concerns within the family. And as Dr. Malhotra said, the stress affects various aspects of physical well-being, and our immunity specifically. Somebody asked for how you can boost the immune response. Being less stressed, right? Because stress, as an endocrinologist, I can tell you, will produce so many chemicals that will depress our immunity, and just as the nutritional state would. So people are reading Google, people are reading news, and people are constantly talking about it, as was mentioned. So that physical stress, the mental stress has become a major illness over the physical illness that may or may not come. So that's important. And prevention is always better, we believe that, but preventing by doing daily routines which are helpful and healthful is different than preventing something by medications or chemicals which may have side effects. So in this case, the risk of side effects of medication and unproven prevention benefits of this medication is not in a balance. So we are not recommending hydroxychloroquine-like medication for prevention for everyone in the community, and definitely not for children, but not even for adults. So we have specific indications for hydroxychloroquine, and we as providers will use them appropriately in those conditions when there is a great indication for the drug and the benefits clearly outweigh the risks of that medication. That's what I would say.
Thank you, Dr. Murthy, for emphasizing the importance of overall health in this time, and for clarifying that information about hydroxychloroquine. So we've gotten a couple of additional questions from parents really asking for further clarifications about the sometimes conflicting information they could be hearing. The multiple parents seem to be concerned really about making sure that their children are getting enough outside time and exposure to vitamin D when so much of their time is spent indoors. And previously, Dr. Mehrotra had discussed that it might be safe still for children to go outside as long as they're taking the necessary precautions. But parents want to know more about the precautions they could be taking and how they could continue to ensure the health of their children through enough exposure to outside.
Sure. Thanks. I think this is a cause of concern, but what we do know is that this is going to be temporary, right? At the temporary phase, we don't know when it will end. It might be another few weeks, another few months, but it will end. And at that point, we can go ahead and make sure we get as much sun exposure as we possibly can. So at this time, you go ahead and take your kids out around the block when they're done as a typical school day. So after the school day is done, they can, be outside, catch the sun as much as they possibly can, and make sure that they're eating well. And the most important thing in terms of information gathering is not to be searching online. Have maybe one trusted source, which could be your CDC website, and your healthcare provider, making sure that you're in contact with your pediatrician, whoever that is. Make sure that, if you have a question, if you think your child has a symptom that may be consistent with corona that you're so worried about, the first call should be to your doctor. Most of the doctors are, evaluating patients through telemedicine, so that they can go ahead and visualize the kid. They can visualize the symptoms. They can go ahead and get the full story and give you a much more informed decision on what the next steps are. This is not the time to be researching all over the net. This is not the time to take your kid to the ER. This is not the time to go out and take your kid to the urgent care unless it is some sort of a life-threatening emergency. But once again, you need to have your healthcare provider to help you navigate this so you're doing the right step. So having good access to your medical care system, having the right way, a right source of information, maximizing the de-stress level that you can possibly have, making sure you're maximizing your nutrition, and being outside and being as normal as you can.
Thank you, Dr. Mehrotra, for elaborating on that.
Can I add to that really quickly?
Of course, please go ahead.
So one thing that all of us have talked about the importance of routine and the importance of scheduling and things like that. With parents concerned specifically relating to what can I do to spend more time outside, or how can I get kids, especially as the weather is getting nicer and nicer now, how can I spend more time outside? How can I do that safely? One thing that kind of aligns with creating a routine is find a safe activity to do and then repeat that activity, daily. So if you have a route that's around your block that is relatively empty, we can walk around the block and there's not too many people outside. Pick a time of day that feels appropriate and take a walk together as a family. I saw a family the other day while I was on a walk, and they just drove their car to an empty parking lot. And there's a lot of empty parking lots now. They were in a school parking lot, and the little girl had a scooter and the little boy had a basketball, and the parents were just watching them, kind of play together in this empty space. It was outside, it was in the sun, and it was away from everyone else. So if you can find, if there are places in your neighborhood, if not, immediately near your own home, if there are places in your neighborhood that you can safely drive to, and create some kind of a place where you can feel away from other people, but also be able to release some of that energy, that's a good and safe thing to do.
Thank you, Dr. Kuriakos. So we'll take just one more question, and then I'll give you all an opportunity to add any information that you would like to emphasize for the parents and the children that might be in attendance today. So the last question that a couple of parents seem to be wondering about is how should they access regular pediatric visits at this time? And is it a good idea to, sorry, let me rephrase. How are they able to continue to keep up with the regular visits they might be needing for their children, in addition to keeping in mind the restrictions that are in place right now? Dr. Mehrotra, if you could start us off.
Sure. The current recommendation is for kids 18 months of age and below. So if you have little kids at home, they should go ahead and go for their regular scheduled well visits with the immunizations at the scheduled time. Now, pretty much, I think all of the pediatricians have set up the time slots where they're seeing the well visits in the morning time and their sick visits in the afternoon time or on telemedicine, so that you're keeping the patients separated, so that there is the minimum amount of exposure to anybody who could possibly be sick or be a carrier for corona. The other thing that you have to figure out from your healthcare provider is, what is their waiting room like? What is the waiting process like? So in our office, if a patient comes in for a well visit, we make them either wait in the car, or we make sure that there's nobody else and they go directly into the room. And all of the intake processing and all of the paper processing, insurance processing gets done in the room. So you are isolating the family in that one room. So these are some of the steps that most of the pediatricians have taken, where they're maintaining the safety of our well kids and not exposing them to the sick patients. And as I said, the sick patients, most of them are being done on the telemedicine.
Thank you, Dr. Mehrotra, for clarifying that process. At this time, as we move towards wrapping up the call, I'd like to give a couple of minutes to Dr. Mehrotra, Dr. Kuriakose, and Dr. Murthy to see if there's any information they would like to add, any parting words that they would like to share with the parents and children in attendance tonight.
First of all, I want to thank all of the families of ManaBadi for listening in and being concerned about their kids to actually be a part of this webinar. I really thank all of the leaders of ManaBadi, including Mr. Veta and our dean here of the school, for inviting us to talk to the families and hopefully alleviating some of the fears that the parents might have. As I'm sure everybody has heard enough, that these are unprecedented times. There's a lot of changes that have happened, but what we know is that we are all going to pull through this together. There is a light at the end of the tunnel. How we can maximize and make the best of the time with our family. This is the time that'll never come back again, where you are constantly locked in with your kids, your spouse for 24/7 for weeks on end. So take this time positively, work with your kids, and enjoy the time that you have. And stay safe.
Thank you, Dr. Mehrotra. Dr. Kuriakose?
Yeah, I also just want to thank all the organizers for the event, all the leaders of ManaBadi, Raju sir, Mr. Veta. Thank you so much for having us. And thank you to all of the volunteers that make this school happen. We also work with a lot of volunteers, so we understand the number of hours and the effort that goes in behind the scenes. So even if I don't know your names, thank you so much for the service that you're providing, not only in this time, but throughout the year. Thanks a lot, Ankita, for moderating and for streamlining those questions. Thank you so much for having us on. And then for Dr. Murthy and Dr. Mehrotra, who are both my leaders and my mentors. So thanks for your guidance and leadership as well. And to the viewers, thank you for joining us. And I hope this doesn't pertain to you, but our thoughts and prayers and condolences for anybody who's lost anyone or has have people sick from this particular virus. In terms of parting words and advice or tips or anything like that, I would just say, when it comes to kids, we've been saying routine, maintain those routines, but acknowledge that this time isn't normal and be willing to be flexible and meet kids where they're at, especially with kids who are having a difficult time adapting to that. So be flexible, know that they're struggling just like everybody else is, but it may manifest differently. With that, stay safe and stay healthy.
Thank you, Dr. Kuriakose. Dr. Murthy, is there anything that you would like to add at this time?
If you give me a chance to speak, I will never say no to it. As a parent, what I learned from my mother is I needed to nurture myself if I wanted to nurture my kids. There's no way you can take care of your children if you're not taking care of yourself. And live the day in a sattvic way is what Dr. Mehrotra's mother would say. She has taught me 3 simple principles. Now, It may not look like a physician speaking, but it is faith, frequency, and focus. What does she mean? Be confident and be faithful that all will be okay. We are going through stressful times, but we will be fine. And uh, focus on the day, focus today, do the best you can. Don't live in yesterday, don't live in tomorrow, and don't multitask. You know, stay with the task you're on in just completing it. And frequency is what Dr. Malhotra and Dr. Curiosipis talked about. Daily routine in a simple, confident way. And have compassion for your kids, um, for understand their needs, understand their age and their, why they behave a certain way, and look at it from their point of view and negotiate your ways with them. And know all will be okay. Medically, you should know that we will be able to manage it. It's just adjusting to this new situation and coping it with well. And get help. If you need help, talk, um, listen to counselors. Reach out to us at the South Asian Institute. We are South Asian Institute at stpetersuh.com, or through SKN Foundation website. You can reach to us. We are available to help anyone, anywhere, if they're going through a crisis or any simple navigation that they need for care.
Thank you so much, Dr. Murthy, for those insights. We really appreciate the time that all three of you have put into being present at this panel tonight. And in addition to taking care of your own patients who might need your resources, you've also taken time out of your personal day to be here for the ManaBadi community. And we are honestly very, very appreciative of that. There's thousands of students and parents that are a part of our ManaBadi community, and you being here today to answer their questions and show your support is very meaningful to us. So once again, to everyone in attendance, these three experts have joined us today from St. Peter's University Hospital in New Jersey and the Sri Krishna Nidhi Foundation. Both organizations have consistently supported our South Asian community, and we're very, very grateful for their presence at this meeting today. I'd also like to thank everyone in attendance just for making the time to learn more and make sure you're educated and have the facts. Before I turn it over to the ManaBadi leadership to conclude the webinar, I'd also like to extend a personal thank you to Mr. Sharathveta and Mr. Raju Chamattigaru, who are part of ManaBadi's leadership. And with their cooperation, we were able to pull together this team of experts and really bridge the gap between medicine and community and make sure that information is reaching where it should. So thank you, everybody, for being a part of this event. So with that, I'm going to turn it back over to Sri Raju Chamattigaru, who is the Dean and President of Siliconandra ManaBadi, to conclude the evening for us. Thank you.
Thank you, Ankita. And you have done a wonderful job today moderating this panel and asking all the right questions on behalf of the ManaBadi parents community. And three expert, doctors here, it's wonderful learning all these great pointers. We want our next generation to be safe, healthy, and then, energetic, and not be worried about everything that's happening there. And, your suggestions today, your tips will go a long way, in helping these kids. And we are doing our part through Siliconandra ManaBadi, wherever we can, by providing these kinds of seminars. And we just did a couple of, entertainment programs, so that way we take their minds away from this, this uncertain times and the stress. So we had a great flute program artist, joining us from India yesterday. And day before yesterday, we had
Some mimicry.
Mimicry artist, doing it and entertaining our family, our communities. And before that, we had a great artist, Gummadi Garu, doing the Padya Natakams, the poems and whatnot. So it was a wonderful thing. And we have many more things to come for the benefit of, our parents. So I want to thank each and every one of you, Dr. Mehrotra, Dr. Kuriakos, and Dr. Murthy Garu. It's wonderful knowing you, meeting you here today. Next time I come to New Jersey, I will certainly be, taking some time to say thank you in person to each one of you. And our leader, Sarath Garu, thank you for pulling this off, sir. I know how busy the doctors are today in this environment, and pulling, bringing them together here to spend an hour, 2 hours with us. And it's wonderful. And namaskaram to all three of you. Sarath Garu, final words, sir.
Thank you very much, Raju Garu. It's always inspiring. And once again, thank you very much, Dr. Murthy, for planning all this. And thank you very much, Dr. Mehrotra. And thank you very much, Dr. Kuriakos. It's a wonderful session today. And hopefully, a lot of information went to my ManaBadi family audience today. Thank you very much. Please take care of yourselves. I know you are serving day and night. I know even weekends you are working very hard, and God bless all of you with sound health. And please take care of yourself too, so that we get more benefited out of it. And stay safe. God bless all, and God bless America. Thank you.
Thank you.
God bless our ManaBadi kids. Thank you, Ankita. Thank you very much. So with this, we are concluding. Good night to all of you. Thank you, families, for joining. God bless all.